I live in Vineland, New Jersey. My name is Julie Campbell, and I am 64 years old. When I was on the table getting ready for my surgery to replace my knee, I was actually diagnosed with leukemia during COVID. My leukemia was in such a deep remission that my doctor discontinued my treatment. I was removed from treatment on October 30th of 2020 for my CML because I had been in remission for so long. So exactly 1 month to the day that they took me off my chemo for the leukemia, I was diagnosed with breast cancer. I had a lump that grew, that it just went from nothing to covering my whole breast. And so I scheduled an appointment with my OBGYN and went in and they told me they wanted me to get some tests. And she said, but I'm thinking that it's cancer. I had such a hard time with my CML diagnosis. I mean, that was a nightmare. And so when I got the breast cancer, believe it or not, it was not as bad. And I think it was because the CML diagnosis actually prepared me for the second cancer. It was more stressful because of the COVID. I had all these doctor appointments and I had to worry about everywhere I went and was I going to get COVID? And I had to go by myself because I didn't want to take anybody else and have them be exposed to that. So I had to do everything by myself. So I didn't have any support. When I was in the hospital, I didn't have any support because I didn't have, my family couldn't come in. The cancer that I have is called triple negative breast cancer. And it's the kind of cancer that moves, and it moves very quickly.
So I first met Ms. Campbell when she was just diagnosed. And it really was in the midst of the pandemic. She also has a second malignancy that is under control. Fortunately, there are tremendous developments in the treatment of breast cancer, options for approaches for triple negative breast cancer. Again, we were able to benefit from all of that research and work.
I'd had IV chemo initially, and then I went to radiation. It was during the radiation treatment that I actually contracted COVID.
Unfortunately, she did not have a mild case of COVID, and she actually required hospitalization that resulted in a delay in her radiation therapy. So Ms. Campbell's care, I think, was impacted by COVID in multiple ways. At the beginning, there was so much we didn't know, and we shut down in many areas. Now, one of the areas that we tried to keep open was clinical trials, and especially therapeutic trials, so patients could still have access to the latest innovations, and in that way still get the best care possible.
I really think the government needs to get involved. If the government would take care of cancer research, then all these people that are getting in there and fighting, they can come up with cures for cancer. It needs to be done.